Hello everyone, now let us discuss about CPT coding guidelines for surgery, musculoskeletal system part 3a. In the current session, we will be discussing about the vertebral column and various definitions that are involved in the CPTs of vertebral column. So, in the vertebral column, we will be discussing about incision, excision, osteotomy, fracture or dislocation, percutaneous vertebroplasty and vertebral augmentation, orthodesis, spine deformity, exploration and spinal instrumentation. These are the various topics that we will cover in the CPTs of vertebral column. Coming to the term osteotomy. Otomy means cutting up or opening. So osteotomy means cutting and reshaping of bone so as to make it stable against weight and pressure. The next term is vertebroplasty. Vertebroplasty is a procedure in which a special cement is injected into a fractured vertebrae. Vertebroplasty is nothing but a special cement, a procedure in which special cement is injected into fractured vertebrae with the goal of relieving your spinal pain and restoring your mobility. The next term is vertebral augmentation. Vertebral augmentation, it includes vertebroplasty and kyphoplasty. It refers to similar percutaneous spinal procedures in which bone cement is injected through a small hole into the skin into a fractured vertebrae in order to relieve back pain caused by vertebral compression fracture. Next is kyphoplasty. Kyphoplasty is nothing but a surgical procedure that expands and stabilizes. Using kyphoplasty, expansion is achieved, and in that expanded space, cement is placed, which is nothing but vertebroplasty. So vertebral augmentation involves vertebroplasty and kyphoplasty. Next term is orthodesis. Surgical fusing of two bones at their joint. In simple terms, bone fusion. Surgical fusing of two bones at their joint to reduce pain and increase stability of the joint. These are some of the terms that we come across in the following CPTs. Now here is the schematic representation of kyphoplasty. Here needle is inserted and a balloon is inflated to create the space, and in that space created by that balloon, cement is injected. The bone cement sets so that the vertebral does not collapse. Now coming to some of the anatomical terms. Facet. Facet is nothing but a small smooth area on a bone or other firm structure, usually an articular surface covered with articular cartilage. Smooth, flat surface is nothing but facet. The next is foramina. A foramen is an opening or hole through tissue, usually bone. Any foramina, it allows the nerves and blood vessels to travel from one side of the tissue layer to the another side. The next term is lamina. Lamina is nothing but flattened posterior portion. Flattened posterior portion of the vertebral arch extending between the pedicels and the midline, forming the dorsal wall of the vertebral foramen from the midline junction in which spinous process emerges. Lamina is the flattened posterior portion of the vertebral arch. In simple terms, lamina is the flattened posterior portion of the vertebral arch. The next is vertebral segment. What is a vertebral segment? It describes the basic constituent part in which a spine may be divided. Vertebral segment is the basic unit in which the spine may be divided. It represents a single complete vertebral bone with its associated articular processes and lamina. Vertebral segment represents a single complete vertebral bone with its associated articular processes and lamina. And the next term is vertebral space. Vertebral interspace. Vertebral interspace. It is the non-bony compartment between two adjacent vertebral bodies. Hence the term interspace. Between two adjacent vertebral bodies which contains the intervertebral disc and two cartilaginous end plates. Here you can see this is the vertebral body and this is the pedicel. And these two, this one and this one, are the transverse processes, and this is the vertebral foramen, which is nothing but a hole or opening through which the nerves and blood vessels pass. And this is the spinous process, and this is the superior articular process. And this area is the lamina. Lamina, foramen, vertebral body. These are some of the terms that we have come across. Facet. Facet, you cannot see facet here. Facet is present in the articular processes. Now let us discuss some of the surgical terminology. The first term is corpectomy. Ectomy is nothing but surgical removal. Corpectomy means removal of vertebral body during the spinal surgery. The next term is facectomy. Facetectomy. As the term indicates, it is nothing but excision of facet joint between two vertebral bodies. There are two facet joints at each vertebral segment. This is important point. There are two facet joints at each vertebral segment. You know what is vertebral segment. The next is foraminectomy. Foraminotomy. Foraminotomy. Otomy means cutting up or opening. Ectomy means removal. ECTOMY. Ectomy means removal. OTOMY means opening. So foraminectomy is excision of bone to widen. Cutting up of bone to widen intervertebral foramen. The intervertebral foramen is broadened by the superior notch of adjacent vertebrae, the inferior notch of vertebrae, facet joint, and the intervertebral disc. The next term is hemilaminectomy. Removal of portion of vertebral laminae, usually performed for exploration of access to or decompression of the intraspinal contents. The next term is laminectomy, excision of vertebral laminae. Hemilaminectomy means removal of portion of vertebral lamina, whereas laminectomy means excision or removal of vertebral lamina, commonly used to denote removal of the posterior arch. The next is laminotomy, excision of a portion of the vertebral lamina resulting in enlargement of the intervertebral foramina for the purpose of relieving pressure on the spinal nerve root. Otomy means cutting up or opening. Here excision of portion of vertebral lamina is seen, resulting in the enlargement of the intervertebral foramina for the purpose of relieving pressure on the spinal nerve root. Thank you for watching. Please subscribe for further videos on medical coding and CPC training.